So what we've seen in practices over the several years we've been working in practices is that basically effective leadership is the foundation of practice transformation. Without it, basically, quality improvement actually never starts, or it just sort of starts and stagnates. We often see a lack of leadership alignment, and that also undermines the change process. And what I mean by that is that sometimes the leadership in a practice isn't really aligned with where healthcare is going, or they may not be aligned with their system, whether that's a hospital or another system, an IPA. Or within the practice, there's lack of alignment between the physician champion and, let's say, the practice administrator. So on many levels, there needs to be leadership alignment. And when that's missing, things tend to fall apart as far as quality improvement goes. And something else we've learned, I would say, is that it's a fairly big culture change to empower teams and to really move toward a team-based care model and allowing team roles to expand. And, you know, in a lot of senses, many practices have been very traditional or hierarchical in how they practice. And in this new world we're joining with patient-centered medical home and medical neighborhoods and things like that, really we have to move much more toward a team-based approach. The active practice transformation is really learning how to engage your whole team into the process. Related to that is empowering people to work at their highest level. You know, when you look at the roles within a practice, often people within their roles can do much more and expand much more than what they're doing now. And you want to think about people not only within their roles, but as their individual skills and talents. You really can't do quality improvement without data. And no EHR that I know of at this point spits out the exact right data in the exact right fashion and the way you want it when you want it. I mean, that's just a given, right? But there are ways that you can get data that can be meaningful to you and your teams. But as Dr. Bender said, trying to sort of embark on quality improvement or on transformation without data is a very frustrating prospect, because you start doing changes, you never know if they lead to improvement. You can't show your team and motivate your team by showing them that the data is improving. Data just really provides the structure around which you do your changes. So I would encourage you to keep trying with data, that it's never going to be ideal, and you have to start somewhere. But if you're going to look at a quality improvement process, you definitely want to start where you can get data.